Hey there, and welcome to MediByte. We're your go-to source for health info that's super clear and reliable. All right, today we're going to tackle a big one. It's something a lot of people have heard of, but maybe don't really get. We're talking about infectious mononucleosis. So, have you ever heard of the kissing disease? I bet you have. It's a pretty memorable nickname, right? But what's actually going on with this illness? What's the real story? Well, it turns out it's way more than just a catchy name. Behind that nickname, there's a very specific culprit, and it's a surprisingly common virus. Okay, so the condition we all know as mono is actually caused by the Epstein-Barr virus, or EBV for short. Now, what's really interesting is that EBV is part of this huge family of viruses. It's actually a type of herpes virus, specifically herpesvirus 4. This is the little guy that kicks the whole thing off. And this is where it gets absolutely wild. You might think of mono as something that only a few people get, right? But the virus that causes it, it's literally everywhere. Get this, over 95% of adults worldwide have been infected with EBV. I mean, that's pretty much everyone. The vast majority of us are just walking around carrying this virus, and most of the time, we have no idea we were ever infected in the first place. Okay, so that begs the question, right? If it's that common, how in the world does it spread? And why do only some people actually get sick from it? Let's follow the breadcrumbs here from the moment of infection all the way to when the first symptoms show up. So yeah, that kissing disease nickname is pretty on the nose. The virus mainly spreads through saliva. But here's the really crucial part. Once you're infected, EBV is with you for life. It can sort of wake up from time to time and pop up in your saliva, which means you could pass it on even when you feel totally fine. And here's the other twist. When little kids under 5 get it, they usually don't have any symptoms at all. It's really the teenagers and young adults who get hit with that classic, full-blown case of mono. And that long delay, that's exactly why it can be so tough to figure out where you even got it from. After you're exposed, there's this really long incubation period. We're talking 30 to 50 days. That's more than a month. So you could be walking around, carrying and even spreading the virus for weeks before you have a single clue. So let's say that incubation period is over and the symptoms finally hit. What does that actually feel like? Let's break down the 4 main ways your body responds to the infection. Okay, here are the big 4 classic symptoms of mono. First up, you've got this extreme fatigue. Second, a fever. Third is a really nasty sore throat. And fourth, you get swollen lymph nodes. You'll probably notice them in your neck. Now, it's super important to remember, not everyone gets all 4 of these. It can be a mix and match situation. I really want to zoom in on that fatigue for a second, because it's the real signature of mono. And when I say fatigue, I don't mean you just feel a little tired. The key word is severe. We're talking about a deep, profound exhaustion that just knocks you out. It's usually at its absolute worst during the first 2 or 3 weeks, but for some people, it can drag on for months. So you might be wondering, besides those 4 main symptoms, are there any other complications to worry about? Yes, there is. And it's a really big one. About 50%, that's half of all people with mono, develop an enlarged spleen. Now, you probably won't even feel it, but this is a serious risk. Why? Because an enlarged spleen is really fragile. It can actually rupture from an injury or even just from some intense physical activity. And a ruptured spleen, well, that's a life-threatening medical emergency. Okay, so the symptoms can kind of look like other things, right? Like a bad case of strep throat. So how do doctors play detective and figure out if it's really mono? It really comes down to blood tests. There's a common one called the monospot test, which looks for specific antibodies your body makes. And to be even more certain, doctors can run other tests that look for the exact antibodies your immune system creates to fight off the Epstein-Barr virus itself. And here's another thing to keep in mind. EBV isn't the only bad guy that can cause these symptoms. There's another herpes virus called Cytomegalovirus, or CMV, that can cause a really similar illness. So what's the telltale sign? Well, EBV mono almost always gives you a terrible sore throat. CMV mono usually doesn't. It's a small detail, but for doctors, it's a super important clue. All right, so you've got the diagnosis. What now? Let's talk about the road to recovery and what treatment looks like. Okay, the first and most important thing to get about treatment is this. Mono is caused by a virus, so antibiotics are completely useless. And right now, there isn't a specific antiviral drug that can just cure it, so treatment is all about supportive care. That just means managing your symptoms and letting your own amazing immune system do the heavy lifting. The recovery plan is pretty simple, but following it is absolutely vital. Number 1, rest. Get as much as you possibly can, especially in those first couple of weeks when you feel the worst. Number 2, over-the-counter stuff like acetaminophen or ibuprofen can really help with the fever and pain. And number 3, and listen up because this part is non-negotiable, you have to avoid any heavy lifting and all contact sports for at least a month. This is all about protecting your spleen and making sure it doesn't rupture. So you finally get through it, the fatigue goes away, you're feeling like yourself again. But what happened to the virus? Does it just pack its bags and leave? Well, not exactly. Just like its other herpes virus cousins, EBV never really leaves your body. Instead, it goes into this dormant or inactive state. It just kind of hangs out, living quietly inside some of your white blood cells for the rest of your life. It becomes this permanent, but thankfully mostly quiet house guest. And that really brings us full circle, doesn't it? When you think about the fact that almost all of us are walking around with this virus inside us, it really makes you wonder, right? What other secrets is our body keeping? Hey, if you found this explainer helpful and you want more clear health info just like it, do us a huge favor. Be sure to like, share it with someone you think should see it, and definitely subscribe to the MediByte channel. Thanks so much for watching.